Hi everyone, this is Ting O, physical therapist at Physical Therapy and Balance Centers in Hazleton, and we're here today with a special guest, Ryan Cody Seacrest, who was an intern for us, and we were discussing a few things earlier today, and he showed some interest in some of the techniques we utilized, and we found out that he is a pretty good lacrosse player playing at Bloomsburg University. So it turns out that Cody actually dislocated his shoulder approximately 2 years ago and has always had some stiffness since then, especially in the back of the shoulder. So what we figured we'd do, and thanks Cody for helping us demonstrate this, we would let you guys see some of the techniques that we utilize for shoulder pain, especially to loosen tightnesses. I did a quick preliminary check and found that Cody has some tightnesses in some of the muscles in the back of his shoulder, which could be contributing to the tightness or the pain that he feels with the cross. So we're going to utilize a technique called myofascial decompression today, otherwise known as medical cupping. And we're going to cup a couple of muscles around Cody's shoulder, and then we'll get him back up, and hopefully he'll be feeling a lot better. We'll see how it goes. Could you take this off of me, please, Cody? We got to attack your skin. And if I could get you to lay down and face me. And for those people who don't know too much about cupping at all, cupping has been utilized in ancient medical practices for centuries, like the ancient Chinese medicines, also used a lot in the Middle Eastern countries and South American countries. The muscles that we want to utilize today is the upper trapezius, where there's a very classical trigger point for people with shoulder pains. The infraspinatus, right about here, which is another very classical trigger point. The posterior deltoid, which is right here, and that seems to be the source of some of Cody's pain, and also in the rhomboid muscle here. So, with medical cupping, you just got to be careful that you're utilizing the right pressures. Some people may have seen it on TV where they use fire, but we obviously don't use fire. I'm sure people may not appreciate that. So all we utilize is a little cup like this, and we attach it to a pump, stick it on the trigger point where it seems to be right here. And for Cody, I won't go too hard because he's actively training right now for lacrosse. So I'll give him a little bit of a pump there. And as you can see, what that's doing is pulling the fascial lines and distracting his tissues underneath, which can be very good at assisting the circulation, also helping tightnesses release. I'm going to put another one in the rhomboid section here. One in the infraspinatus. There's a very classical trigger point that affects a lot of people's shoulder problems. And you let me know if anything hurts real bad, Cody. Okay? He's a lacrosse player though, so he's pretty tough. And then we're going to put a final one in the posterior deltoid right about here. Okay, as you can see, some of this stuff is starting to turn nice and red in there. That means that we're getting the circulation going. And it also means that we're encouraging the flow of nutrients in there as well. And the key with myofascial decompression versus just cupping is what we'll do is imagine this pulling your structures or separating your soft tissue structures under your skin. And as it's doing that, what we want to do is we want to stretch some of the adhesions that may have formed underneath. So in this position, we're actually going to get Cody's arm and start to stretch a little bit, so you can see that some of that underneath stuff is starting to stretch and breaking up any scar tissue adhesions that might form. And we're going to get into some of the motions that Cody is a little tight in, which is reaching across his body. And after you've dislocated your shoulder, it's actually good to have a little bit of tightness in the front of your chest. But you want some looseness in the back of your shoulder, so that way the tightness in the back doesn't pull the head of your shoulder out of the socket. So we'll just do a couple of stretches, and as you can see, Cody's starting to get a little bit red in there. And I'll take some of these cups off. So for a classical treatment session, what we would do next is maybe work some of the structures to get the circulation flowing. A good technique to utilize is instrument-assisted soft tissue mobilization. And for the people who follow us on our YouTube channel, you'll know that we do some kinesiology taping. And kinesiology taping, again, is another great method to help keep things under control after we've done the cupping or the myofascial decompression session. So, Cody, how are you feeling there?
Good.
If I could get you to sit up. Oh, just watch that there. Go and sit up. And what do you feel there? How does things feel?
Loose, for the most part.
Okay, and I'll get you to reach across your shoulder. And that still seems a little tight, but does that feel any different?
Yeah, it's easier.
Cool. All right, so that's a great technique that we utilize for muscular or soft tissue tightnesses, and hopefully for Cody, we'll have him playing a little better this weekend, right, Cody?
Yeah, thank you.
Thanks for joining us.